With a flood of information on the internet, with a flood of pictures before and after, with a flood of results which are like straight out of the science fiction movies, people are more and more led to believe, for commercial reasons, that every hair loss pattern, that every hair loss grade, every Norwood scale has a solution through hair transplant. However, this is not so. Every case is unique, every case is different as regards the level of baldness, as regards the availability of grafts in his donor area, and as regards his objectives, what he wishes to achieve. And objectives and goals keep changing as you age. So in an effort to bring to you real cases, real patients with real objectives and goals, with real aspirations to get a hair transplant, patients with rational objectives, patients with rational goals, patients who've done the research in hair transplant. These are the coterie of patients who will never be disappointed, who already have gone through a host of results and who have analyzed the results because they're intelligent enough to do so. Others who think that a hair transplant is a miracle cure, a cure-all for all levels of baldness, a low hairline as they wish it to be set, high density, increasing volume of thinning hair. These are the patients who should be wary, and these are the patients who should be listening to my talk. Well, in this case, a grade 6 patient who came to me a few years back. The plus points in his case are that he is a very rational, very well-read, very researched patient. He knew that to achieve his objectives of a head full of hair, he had to have a conservative hairline. And he knew very well that his graft donor area, the scalp donor area, was not replete, was not full, was not lush with grafts. That is, in the first session, not more than 2,500 grafts could be harvested, keeping the ratio of harvest 1:5. I consider myself very lucky whenever I get such patients, because such patients' objectives and goals are easily reset through counseling, through consultations online and in person. So 2,355 scalp grafts were done for his hairline and his mid-scalp. And you can see his result after 1 year of his hair transplant when he came in for filling of the crown area. And when he comes back for another touch-up, as his crown expands, I'll be able to post the full video of his complete hair restoration result. So this is his result after 1 year of hair transplant. Patient is very happy that he has been able to meet his objectives and goals that he set out before starting his hair restoration journey. So these are the patients which we like to get. Patients who are well researched, who are not very irrational. So these are the patients who are ideal candidates, and I love to have these patients at my clinic. So this patient, you can see the natural hairline, the natural groupings of singles, doubles and triples in this video. This is achieved through microscopic dissection of grafts after they are harvested and before they are planted, using our ingenious Anagen Q+ technique, which is a modification of DHI technique. Thank you for watching, and I'll get back to you with more such realistic videos, more such patients whom you can compare realistically your hair loss pattern with, and have a realistic idea of what you can achieve and what you cannot achieve through ethical surgical hair restoration. Thank you for watching.